I'd like to welcome everybody to our Socialist Equality Party Health Workers online forum today. My name is Cheryl Crisp. I'm the National Secretary of the SEP and I'll be chairing today's meeting. Just to explain, we've organised this meeting to engage in a discussion about the situation confronting healthcare workers, both here and internationally, and importantly, the perspective that the World Socialist website and the SEP is fighting for. It is, I don't think, an exaggeration to say that health workers have not faced such dangers in their workplace really outside of conditions of outright war. Yesterday, the number of worldwide infections surpassed 30 million. In a couple of days, there will be 1 million deaths from coronavirus. Of those 30 million infections, it is reported that 1 in 7 are health workers. The COVID-19 pandemic has really exposed the complete inability of capitalism to meet the demands of this crisis or really any other. While the world confronts the crisis of the pandemic, at the same time, wildfires are raging through California and neighbouring states in the United States. This, as we know, followed the worst bushfire season on record here in the 2019-2020 season. So whether it's climate change, whether it's a health crisis, or really the unrelenting drive to war, which is underway, this system has brought mankind to the brink of an existential crisis. In health, the pandemic has highlighted and exacerbated what has been an international process of the gutting of health budgets, resulting in hospital closures, ward closures, understaffing, increased workloads, under-equipped health departments, and really a two-tier system which exists really on an international scale. While scientific knowledge is able to unlock the properties of diseases or of life itself, the ability of broader sections of the world's population to access these breakthroughs are blocked by the policies of governments who serve the profit drive of pharmaceutical companies and private health funds. In effect, they serve the stock market. If there's any conception that these same experiences are not being had here, that would be a grave error. Today, a secret Victorian government report was leaked, which has exposed the level of infections which rip through the hospital system in that state. The extent of infections amongst healthcare workers has been consciously hidden both from the hospital and healthcare workers themselves and from the rest of the population. The report, which includes statements from doctors, nurses, aged carers, document that the spread of the virus in the hospital system is the result not just of the infectious nature of the disease itself, the mantra of Daniel Andrews and the political establishment, but lack of infection control, lack of PPE, understaffing, and overcrowded wards. But in that sense, that's what we want to discuss with you. I know some of you are health care workers, others are not. Others have experienced the situation in the health system and the aged care system, and we want you to tell us your experiences. So the format of today's meeting will be an opening report from Gary Alvernia, who is a doctor in the public hospital system in Australia, and he will outline the global nature of the crisis which we confront and the tasks necessary to combat it. That will be followed by a report from Julia Thomas, who is the branch secretary of our Newcastle branch of the SEP. Both Gary and Julia have written really quite extensively on the situation in health and also in aged care. After the reports, we'll open up for questions for discussion, for comments, contributions, and anything else that wants to be raised. We will also point you to our Mearing Books site and your ability to donate if you so wish. But with those few words, I would like to, and I'm very pleased to introduce Gary Alvernia, who will deliver the main report.
Thank you, Cheryl. Thank you all for attending. The International Committee of the Fourth International, our organization, the World Trotskyist Movement, including its Australian section, the Socialist Equality Party, has described the coronavirus pandemic as a historical trigger event, analogous to the assassination of the Archduke Ferdinand prior to World War I. That event, though heralding a coming catastrophe like COVID-19, did not create the crisis of capitalism, but accelerated its historical breakdown and exposed its complete inability to solve the problems confronting humanity. For just like that war, the destruction of life and social conditions caused by this disease was preventable, and its continuation and worsening is not in the final analysis a product solely of its virulence, but by the conscious policy of the capitalists, that is to say, the multi-billionaire financiers and their minions in government, to enforce a policy of profits over lives. In 2020, COVID-19 exposes the consequences of decades of mounting inequality, systematic destruction of public services and infrastructure, the growth of national geopolitical rivalries, and the overall impoverishment of the working class. And just as World War I was only brought to an end by the intervention of the working class, above all through the Russian Revolution in 1917, the catastrophe confronting the world today will only be resolved by the active and conscious role of the working class internationally. Our analysis of the situation in Australia necessitates a review of the international situation and the contrast between the realities facing the working class and capitalist elite globally. We are now in the 9th month of the coronavirus global disaster. Since its initial identification in the city of Wuhan by Chinese and World Health Organization authorities on New Year's Eve 2019, the virus deemed the severe acute respiratory syndrome coronavirus 2, or SARS-CoV-2, causing the disease known as COVID-19, has spread to every nation in the world, infecting over 30 million and killing nearly 1 million, as you can see by that graphic. These are very conservative estimates. At present, the rate of infection is globally is accelerating, with the single greatest number of infections reported this week. While rapid progress has been made towards understanding the virus, including its structure and behavior, much is unknown, and as yet, no effective cure or vaccination exists. What is indisputable, however, is the severity of the disease. With a mortality rate of 3% of confirmed cases, far higher for those who are vulnerable, it is at least 30 times deadlier than the seasonal flu, though it spreads as easily. Furthermore, devastating complications face many survivors, including heart failure, stroke, and long-term physical and psychological disability. As is true with most diseases, it is the elderly, those affected with chronic disease, weakened immune systems, or living in polluted environments who are at greatest risk of death or disability. But youth, location, or good health are no guarantees against COVID-19. Yet while the virus does not respect race, creed, or nationality, it does disproportionately impact the poor. We are not all in this together, and in the rates of unemployment, impacts of social isolation, and ultimately, risk of death, the experiences of the working class and youth and poor is very different from the rich who live off their labor. The super rich have received urgent responses to defend their massive wealth. From the beginning, massive amounts of money were made available to financial markets, vastly exceeding the corporate handouts of 2008, as you can see. As fears of a stock market plunge circulated the globe, trillions were pumped into the stock portfolios of Wall Street. Hundreds of billions were handed out to major corporations in Australia alone. Given the exceptional peril and the interconnectedness of the world which allowed the virus to spread so quickly. Many rightly expected a similarly urgent, unified international response, with massive investments in healthcare infrastructure, research, and personnel, and with considered guidance based on scientific advice. Nothing of the sort has happened. The immediate response of governments throughout the world was to disregard the experience of China, where a mass mobilization of resources and a severe lockdown were needed to avert total disaster. Even as the virus spread, governments and health authorities resisted the most elementary measures of quarantine and testing, allowing clusters of infections to rapidly grow from tens, then hundreds, then thousands of cases before taking any action. In the first months of COVID-19, a malign neglect of complacency and denial was in many countries the order of the day, with governments encouraging a business as usual as the deadly virus spread. The development of mass testing and maintenance of accurate statistics regarding the number of COVID cases and its spread was in many countries delayed, often an act of defiance of the WHO. In some cases, such as Brazil and the United States, testing and record keeping has been actively sabotaged at the urging of the regimes of Jair Bolsonaro and Donald Trump, with the tacit support of all political parties in those countries, who viewed the catastrophic rise in numbers as inconvenient to their plans of keeping the economy open. The scientifically debunked policy of herd immunity, which claimed that allowing the virus to spread would lead to its speedy resolution, was advanced in practice by governments ranging from the United States, Brazil, the United Kingdom, Sweden, and a myriad number of others. This criminal position was only temporarily retreated from in the face of overwhelming popular opposition, as the world watched in horror as COVID first ravaged China, Iran, Spain, and Italy, and predictions of millions of deaths in the UK and the US alone became public knowledge. That's from the paper that predicted that. You can see how high the death toll would have been had no measures been taken. The lockdowns which followed were limited, crudely developed, and arbitrarily enforced. These were coupled with limited assistance programs in the form of marginally increased welfare payments and often nebulous promises of job retention, constantly in threat of being cut or rescinded altogether. The lockdowns themselves were full of loopholes. Most critical among them were those made for essential workers, those involved in healthcare, manufacturing, energy production, and agriculture, among other industries. These workers have continued and continue to work through the lockdowns, often in workplaces with active COVID cases and with minimal or no protective equipment. Despite all this, the lockdowns proved effective in suppressing rates of infection, and in Europe alone were calculated to have saved millions of lives, as you can see. Yet before the virus could be eliminated, the ruling elites of virtually every nation clamored for the reopening of the economy, which is in essence to force workers back into the workplace and children and students back into schools and universities before they were made safe. The capitalists viewed the restrictions on workplaces, on parents staying home to homeschool their children, expenditures and social support benefits, and demands by workers for adequate safety measures as intolerable obstacles on their profit margins and the continued hyper-exploitation of the working class. It is this cure that they see as worse than the disease. The result has been a massive worldwide increase in COVID cases since June, sometimes compelling additional lockdowns, as in Melbourne, and this week, the entire nation of Israel, which re-entered lockdown. To justify this criminal push has seen a grotesque and seemingly endless barrage of lies and fabrications surrounding the virus. Initially, it was proclaimed that the virus only endangered the elderly, until young people ended up on ventilators. Without any scientific evidence, school children were proclaimed to be safe from severe infection and casualty until young children began dying from vascular diseases and heart failure. Phony cures, including most infamously hydroxychloroquine, bleach, and UV radiation, as well as more subtle yet equally useless products, have been advanced. Where outbreaks occur, workers and youth are rapidly blamed, often without proof or context. Draconian penalties have been imposed upon workers without question or compassion should they breach harsh lockdown restrictions, and police intimidation and violence are routinely employed. Finally, utter contempt towards the victims has been the underlying sentiment. With the statements of US President Donald Trump, "It is what it is," and former Australian Prime Minister Tony Abbott, "Let the elderly die," only the crudest expressions of a widely held consensus in political establishments. The most horrifying and vile expression of the policy of profits over lives is to be found in the United States, the richest and most powerful country on earth. Accounting for just 5% of the world's population, but over 20% of the total number of COVID infections and deaths, the state of coronavirus in that country is a deliberately unmitigated disaster. Lacking any comprehensive public healthcare system, the starkest realities of COVID have been laid bare. That inequality is the greatest determinant of survival. That private healthcare means deluding of workers in exchange for denial of treatment. And that there is no layer within the ruling class that intends to defend the rights or even the lives of working people. The heroism and self-sacrifice of workers, particularly healthcare workers, risking themselves in what are increasingly and appropriately called the front lines, has been met with indifference and neglect by the ruling elite. While the expressions of solidarity and affection towards health workers by the general public is genuine, the true attitude of the ruling class can be seen by the estimated deaths and infection rates of healthcare workers, for which there has been no systematic or accurate global tracking to date. More than 2,000 healthcare workers in 74 countries at least have died from COVID-19 infections, nearly half that number in the US, and healthcare workers account in that country for an estimated 20% of infections, subjecting their families and friends to a far higher risk of exposure. This is directly due to a lack of protective equipment, which has compelled workers to, in many cases, accept unsafe environments, reuse masks and gowns past their expiration, come to work unwell, or pay for equipment out of their own meager wages. Healthcare workers in the US, for example, are denied legally mandated paid sick leave for the explicit purpose of forcing them to work. Governments organize rounds of applause for healthcare workers, but no provisions for their safety. Where workers have raised concerns and taken strike action to oppose this criminal negligence, they have been subjected to intimidation, sackings, and indifference by their employers and management, with the trade unions betraying their struggles. This dynamic is not confined to one country. For example, doctors in Pakistan were beaten when they protested a lack of ventilators and disorganized public health response. In Russia and Ukraine, doctors and nurses have been threatened with prosecution for exposing underpayment of salaries and compelled to go on hunger strikes to protest conditions. And in Australia, over 3,000 have fallen ill with the virus in Victoria alone. The struggles confronting healthcare workers mirror those of all workers. On our website, the World Socialist website, we have published hundreds of articles interviewing thousands of workers and youth internationally and in Australia this year, documenting the absence of safe conditions in workplaces, ranging from car factories, nursing homes, Amazon warehouses, abattoirs, universities, and schools. COVID-19 was hardly the first virus to threaten a global pandemic, and for at least 20 years, warnings were made that one was imminent. The experience of SARS in 2003, the swine flu in 2009, the West African Ebola epidemics and Zika virus epidemics in 2015 and 2016, and the Middle Eastern respiratory virus all indicated the imminent dangers. Despite years of research, no funding was put towards the development of vaccines, and austerity measures have subsequently reduced the number of available critical care hospital beds, medical equipment, and trained personnel. The transmission for coronaviruses, which originate in animals and spread to humans under conditions of close proximity and poor sanitation, was well understood. Governments were well aware of the danger of COVID from January onwards at least. Bob Woodward, the American journalist's revelations were withheld for 6 months and after the deaths of 200,000 people, of Trump's real attitude to the virus, only highlighting the complicity of all the political elite. For it is not feasible that Woodward did not relay this conversation to his employer, the Washington Post, or to his political allies, the Democratic Party. Similar information was available to the governments and senior officials in nearly every country, including Australia. That with few exceptions, the failure to prepare for the virus, unwillingness to build up health infrastructure, and reversal of lockdown measures has been the same course pursued internationally, indicates not personal incompetence or criminality of this or that official, but rather the predominance of the interests of Wall Street. And of course, that raises what an alternative approach would look like. An internationally coordinated response to the pandemic would divert the funds squandered on Wall Street, military expenditure, the billionaires and multimillionaires, to the buildup of healthcare infrastructure, provision of modern medical equipment, adequate personnel numbers and training, and provision for care of their workers and their families. But how is this to be achieved? From the World Socialist website statement on the 23rd of June this year, for international working class action against the coronavirus pandemic, I will quote, "Control over the response to the pandemic must be taken out of the hands of the capitalist class. Mass action by the working class, coordinated on an international scale, is necessary to bring the pandemic under control and save millions of lives that are now at risk. The fight against the pandemic is not only, or even primarily, a medical issue. It is, above all, a matter of social and political struggle." Now, to conclude, I will also quote Dr. Benjamin Mateus of the Socialist Equality Party in the United States, our sister party. He said, "The lives that have been lost as the result of the gross absence of preparation, which is the result of the subordination of human need to private profit, will not be forgotten. The change in consciousness is already underway. People are cheering healthcare workers and not bankers. There is not going to be a return to the status quo. Millions of people all over the world, having passed through this uniquely global experience, will perceive and think about reality in a different way. Our program is lives over profit, and we know that the only social force capable of achieving a progressive solution to the coronavirus pandemic, that is to say the elimination of the virus, is the working class, united internationally in the cause of world socialist revolution to free the world's resources, its scientific potential, and its labor power for the safety and benefit of humanity." Thank you.
Thanks, Gary. That was a very helpful report, I think, and will provoke, hopefully, a lot of discussion. I think, as Gary has outlined, the experience with the pandemic has been a very international one. This is, as we have analysed, akin to the experiences of war. There is no section of the world's population, and in particular the working class and the poor, that have escaped its impact. Much has been made in Australia about how the measures here flattened the curve, how the virus had been beaten. And certainly the developments in Victoria only expose that the measures which Morrison reluctantly imposed in March in the terms of the restrictions, and that were then prematurely raised, created the conditions for the re-emergence of the virus in Victoria. What it proves, and Julia's contribution next will outline, that Australia is no exception at all. And so what she will do, and if you were able to, you would be clapping her, speak on what the real situation is in this country. So I'll just pass it over to you, Julia.
Thanks, Cheryl, and greetings to everyone who's participating today. I think the situation that Gary's just outlined highlights that this is no different in Australia. Any conception that the political establishment here has a different approach to dealing with the virus than Trump in the US, Johnson in the UK, or Bolsonaro in Brazil would be an error. There are now over 26,000 recorded cases of COVID-19 in Australia, and over 800 people have died. While the Morrison government knew of the virus at the beginning of January, it was only as infections surged in mid-March that lockdown measures were imposed. It was the widespread anger and concern of doctors, teachers, parents, childcare workers, and retail workers calling for the closure of schools and other non-essential services that forced governments to announce partial lockdown measures. These restrictions were still extremely limited. While hospitality and entertainment were closed, construction, mining, manufacturing, and most retail remained open. At the same time, the Morrison government established a de facto national unity cabinet with Labor and Liberal state premiers and instituted the largest bailout of corporations and business in Australian history. This was 10 times greater than in the 2008 global financial crisis. More than $400 billion has been siphoned to the banks and major corporations. At the same time, and in collaboration with the unions, particularly the ACTU Secretary Sally McManus, the conditions of millions of workers have been gutted. Jobs, penalty rates, hours of work, and working conditions have been refashioned. Almost as soon as the corporate bailouts were secured, in April, the federal government declared that Australia had succeeded in flattening the curve of COVID-19, and with the support of every state premier, both Labor and Liberal, insisted that it was possible to manage a safe level of COVID-19 infections. What in fact this meant is that restrictions should be lifted, knowing that more people would be infected and would die. This was highlighted when, on April 27th, the government rejected a report from 100 academics, mostly epidemiologists and medical scientists, explaining the necessity of an elimination strategy through increased testing and contact tracing, as well as the extension of the lockdown beyond mid-May, in order to have, quote, fewer total infections, hospitalizations and deaths, and better protection of vulnerable populations than any of the alternatives. Contemptuously declared on May 1st, we need to get businesses open. We need to enable Australians to go back to work. We can't keep Australia under the doona. The rush to prematurely reopen the economy in May and force workers back to work led to a resurgence of the pandemic, particularly in Victoria. The response of the Victorian state Labor government was was one of law and order and wasn't a medical response. Following the hard lockdown of the public housing towers, enforced by 500 police on August 2nd, the Victorian government declared a state of disaster involving a nighttime curfew. Why weren't 500 doctors, nurses, healthcare professionals dispatched to assist with the situation in the towers? One of these reasons is that the public health system in Victoria has been so effectively gutted that there wasn't medical staff to send. The money has in fact been spent on police and tax cuts to business. Nothing was done to bolster the capacity of hospitals or to prepare the health system for a surge in COVID-19 cases. In justifying the lifting of coronavirus restrictions in May, governments proclaimed that they had increased hospital capacity to cope with any surge in infections. In fact, it was later reported that in Victoria alone, an order for 3,000 intensive care monitors in April was slashed. Plans to buy hundreds of defibrillators from overseas never proceeded, and a proposal for a 750-bed intensive care facility at the Melbourne Convention and Exhibition Centre was also quietly shelved. Health workers in Australia are being infected at a rate 5 to 6 times higher than the rest of the community. This is entirely the result of inadequate personal protective equipment, infection control measures, and staffing levels. As of September 16th, there have been 3,477 recorded cases of COVID-19 among health workers in Victoria, with 140 cases currently active. Despite initial claims from the Andrews Labor government that the majority of health worker infections occurred outside of the workplace, and that workplace infections accounted for just 15 to 20% of cases, it has since been confirmed that at least 70 to 80% of quote-unquote second wave COVID-19 infections in health workers in Victoria were acquired through work. This slide on the screen now shows a breakdown of the number of cases among health workers in Australia, and it shows that of the total cases, just 492 have been determined not to have occurred in a healthcare setting. Cluster outbreaks have occurred in a number of major hospitals. One of the largest outbreaks was at Frankston Hospital, where more than 600 staff were forced into isolation after being exposed to coronavirus, and more than 50 staff have tested positive. According to the Australian Nurses and Midwives Union, workers raised concerns with them about infection control practices at the hospital, access to appropriate sizes of N95 masks, fit testing and fit checking, and staffing levels in COVID-19 and suspected COVID-19 wards. Despite having this information, the union has done nothing to address workers' concerns or to advance demands for adequate PPE, infection control and staffing. In another outbreak in August, the Royal Melbourne Hospital was forced to shut down 4 of its wards after an influx of patients from aged care homes hit by their own coronavirus outbreaks in July eventually led to the virus spreading through several wards of the hospital. More than 260 healthcare workers ended up falling sick between July and August, with more sent home to quarantine. Despite calls for a full breakdown of cases in healthcare settings to be released by the Victorian Department of Health and Human Services, the data is being released only sporadically. A report today by the Saturday paper contained details of a confidential government document that revealed that outbreaks of the virus have been reported in at least 8 hospitals in the past week, some of which have not been publicly announced by the Department of Health and Human Services. The figures in the report show that hospitals have become a key risk area and that, quote, staff at some of the hospitals have not been told about the transmissions happening in their workplaces and are not being offered extra protection. In the week leading up to August 5th, healthcare workers were 11% of new infections. In the week leading up to September 16th, health workers, aged care residents and their close contacts made up 69% of all new cases. Despite health workers' anger and concern over inadequate PPE and infection control, Victorian State Labor Premier Daniel Andrews responded to this high number of cases among health workers by saying that it, quote, further demonstrates the wildly infectious nature of the virus, and that his message to health workers who get the virus at work was that they should, quote, put in a work cover claim straight away. The virus has been allowed to tear through aged care facilities with over 2,000 total infections among elderly residents and hundreds of staff. Over 600 residents have died. More than half of COVID-19 deaths in Australia occurred in residential aged care. Some infected residents have been denied hospitalisation and have been left to die in homes that are understaffed and unequipped to treat coronavirus patients. The appalling conditions in aged care existed well before the outbreak of the pandemic, which has exacerbated a decades-long crisis. Extensive privatisation and the gutting of public healthcare carried out by successive governments, Labor and Liberal National alike, has meant that the needs of the elderly and infirmed are subordinated to the profit requirements of the corporate and financial elite. The comments by former Prime Minister Tony Abbott that the elderly should be left to die expresses most bluntly the attitude and policy of the entire capitalist class towards the working class and those most vulnerable to the coronavirus. He explained that not enough politicians were, quote, thinking like health economists, trained to pose uncomfortable questions about the level of deaths we might have to live with, end quote. It is a lie that there is not enough money for a humane, scientific response to the pandemic. While over $400 billion has been siphoned to the banks and major corporations, a miserable $2.4 billion was pledged to health to combat one of the most infectious and virulent viruses experienced. Meanwhile, the billionaires continue to expand their fortunes amid the pandemic crisis. By June, Australia's richest 20 people had increased their wealth by 32%, to a total of $189 billion since last year. The collective fortunes of this roomful of people far exceed the entire federal budget for health and education in 2019 to 20, which was $118 billion. And in July, the government announced that it would allocate $575 billion for wars and military preparations over the next decade. During the pandemic, the trade unions have largely remained silent about the conditions facing health workers and have blocked any independent struggle by workers for the proper provision of PPE and other measures to stop the spread of the virus and save lives. This is not only the case with the health unions, but throughout all workplaces and industries. A recent statement by the Socialist Equality Party, published on the World Socialist website, explains, quote, "The experiences through which the working class in Australia is passing is an international one. Governments in every country have responded to the threat of the pandemic from the standpoint of protecting profits, not lives. The health crisis has revealed the inability of capitalism to respond in the interests of society as a whole. This underscores the necessity for the working class to take action independently of and in opposition to the trade unions. The Socialist Equality Party is fighting for the establishment of rank-and-file safety committees, which are controlled by workers themselves, to enforce health and safety conditions in workplaces and hospitals, and to organise resistance, including strike action against unsafe conditions and in defence of jobs, wages and conditions. Such committees are being established in schools and auto plants in Australia, the US, Germany and the UK, and the same must happen here in health." Thank you.
Thanks very much, Julia. Well, at this point, I think both Gary and Julia's reports have provided a great deal of food for thought and discussion. If there's any questions, anybody who wants to make points of their own, anything at all, this is your chance. So I'll open up now for any sort of discussion or questions. Anything at all. I know there's numbers of healthcare workers in the audience. There's aged care workers, there's people who have intimate knowledge with aged care, nursing, doctors. So, or if you prefer, you can write in the chat, in the question and answer session. If you are Tom, sorry, why can't I see you? Tom wants to speak, okay?
Hello, can you hear me?
Yep.
Well, thank you very much for those reports. And I'm Tom from the Socialist Equality Group in New Zealand. And I thought I would just contribute something about the situation here, considering that New Zealand has been glorified for its COVID-19 response, including quite extensively in the Australian media. It's been held up as an example, and Jacinda Ardern has been hailed. And it is true that the government imposed lockdowns that were more severe than those in Australia in March and April, and they were temporarily able to suppress the virus, which had not spread as much as it had in other countries. But I think it would be a great mistake to believe that somehow this government's priorities are any different from those of the Morrison government in a fundamental sense. And I think all of the priorities that the speakers today have outlined, placing the interests of big business above healthcare and above the lives of working people, all of that is true here as well. And the country still remains highly vulnerable if there is another major resurgence of the virus. And there have been significantly, complaints from healthcare workers who have really been just terrified of going to work at all, as they have in Australia, I'm sure. There's been widespread shortages of PPE in hospitals and in aged care facilities, which has definitely contributed to the spread of the virus and the deaths that there have been in New Zealand. And then after the virus was supposedly eliminated in May and all of the restrictions were lifted, much earlier than, against the advice of numerous healthcare experts that the government itself had employed as advisors, they lifted the lockdown prematurely and then failed completely to carry out community testing. Testing just completely dropped to just a handful per day, and then they were celebrating 100 days of no community transmission, and then on, I think, the 102nd day, they discovered in August a new outbreak in Auckland that had gone completely undetected and spread to hundreds of people due to the abysmal lack of testing. So a new lockdown was imposed in Auckland, but the government assured businesses they were not going to do a repeat of the nationwide lockdown. So I think, this, yes, it would be very wrong for anyone to look at New Zealand as somehow a capitalist government that has managed to respond in a more humane way, placing the interests of the population ahead of business. I should say just a couple more things. I mean, there is an election coming up here, and the government is promising to continue to systematically starve the healthcare system of all the funding that it requires. There have now been 2 televised debates between the health minister, Chris Hipkins, and his opponent in the National Party, Shane Retty, which have been extraordinary because really both parties, Labour and National, agree fundamentally on everything, that there has to be essentially austerity throughout the health system, which is grossly underfunded. According to one estimate, the public health system needs another 25% more specialists nationwide. That's the level of staffing shortage and unmet need as a result. And the response of the health minister when that was put to him on television was, quote, "You can't just magic up the workforce out of nowhere. To train people to do these things takes time." He's continually said that in the current economic environment, it's just not realistic to even do the things that the Labour Party promised it would do when it was elected in 2017. Such as reducing the price of doctor GP visits. In New Zealand, I think, unlike Australia, everyone basically, except the very, very poorest, has to pay a fee whenever they see a doctor. That's part of the gradual erosion and privatisation of the system that was begun in the 1980s by the Labour government then. And the minister, Chris Hipkins, said this is not going to change because, quote, "financial priorities have had to change as a result of COVID-19, end quote. I think that is particularly perverse because, you have this major health catastrophe, and that is now being used to justify further cuts to the healthcare system. We don't have enough money because of COVID-19. Well, the reason they don't have enough money is that in New Zealand, just as in Australia, the United States, and everywhere else, governments have given tens of billions of dollars, well, trillions of dollars on a world scale, to bail out businesses and the banks. In New Zealand, the figures are that they have put aside $50 billion in pro-business subsidies. They've allocated as much as $100 billion for quantitative easing, basically handing money over to the banks. These are just astronomical sums for a small country with a population that's about the same size as Melbourne. this is creating, and healthcare workers are being told there's not enough money for them. Just another point on that, there's currently nationwide industrial action here by about 3,000 nurses employed in private practices throughout the country who are striking because they are paid less than nurses in public hospitals. And the Minister of Health, Chris Hipkins, has refused to increase funding to address this pay gap. Public hospitals, by the way, the staff there are extremely low paid and understaffed. Despite launching a nationwide strike in 2018, which was the first nationwide strike by public hospital nurses since 1989, that was sold out by the nurses' organization, the Union Bureaucracy, which forced through a deal that basically froze wages and failed to address the demand of workers for a safe level of staffing in hospitals. And that is what has left the country totally unprepared for COVID-19. And the union bureaucracy really played a criminal role in that. They echoed entirely the justifications of the Labour government that there wasn't enough money to immediately meet nurses' demands for better wages and for a better ratio of staff to patients. And the irony of that is that at the time, the health minister declared that the government had to put aside its multi-billion-dollar surplus in the budget in case there was some sort of emergency down the road. And now, I mean, when the country is unquestionably facing an emergency, a healthcare emergency like the rest of the world, he says there's not enough money for the healthcare system because of that. So I think all of the points that were made in the opening reports apply here. And one other point, I mean, we pointed out on the World Socialist website, these cuts have also contributed to a deadly measles outbreak last year in Auckland, which was a direct consequence of the government's failure to heed the warnings about the low rate of vaccinations. And that outbreak spread to Samoa, where it killed about 80 children. That's 4 times the number of people who have died in New Zealand from COVID-19. So that was a catastrophe for which this government is responsible. I think the record really shows that in both Australia and New Zealand, I mean, not to mention the United States and Latin America and Europe, there's really no party in Parliament here, no capitalist party that can be trusted to safeguard public health. And so I agree with very much with the comments of both the speakers today that what's required is the building of a new socialist party, which is what we are fighting for in New Zealand as part of the International Committee. So just wanted to make those points. Thank you.
Thanks, Tom. That they were actually very helpful and certainly highlights what is the real situation that exists in New Zealand, which again is something which is not reported in the mainstream media. We actually have quite a number of questions and comments. I'll just read out a couple of comments that we have from. One is an aged or a former aged care worker in Perth, and somebody in Queensland who deals very closely with the aged care system. So from Sally, hello from Perth, WA. I worked in aged care before my injury in June 2019. I'm still in contact with care workers. Management hide PPE. When a carer raised her concerns regarding opening it back up, management told her, quote, "Your pay rate doesn't give you permission to make that decision." And connected to that, Jenny has raised, and this is in regards to Queensland aged care. Up until a month ago, health workers in hospitals and in aged care and home care were not required to wear masks. When I repeatedly asked my mother's home care workers provider why they were not given masks when helping the elderly with their daily needs, I was first told we're following state government guidelines, then federal government guidelines, and finally, about a month and a half ago, World Health Organization guidelines. Like others, I bought masks to give to the workers when they came to the house. It was only a month ago the provider was given the wear masks advice by the Queensland State Government, but the workers had to buy them for themselves. A few weeks ago, only the provider started actually giving the workers masks. Health workers have been sacrificed on the firing line, and so have the elderly. And then just in regards to the issue of the unions, we have a question: what would be the SEP's advice for medical workers who are thinking of establishing a union at their workplace? And Sally Ann has made a comment saying, I have also been told the unions have been absent. A lot of aged care workers are no longer in the unions. So that's one question. What would we say to health workers who want to join the union? And then there's a question from Steph, who says, I agree that the Victorian government was very heavy-handed with the most vulnerable parts of society. How would the SEP have dealt with the outbreak? And then one other, which I'll raise now, and I know we've got people who've put their hands up, and I do apologise, I will get to you. How can we hear more about, or can we hear more about the erosion of the healthcare system? Who is responsible for these cuts, and how have they been able to do it? So I'll open up, and if Julia or Gary want to address any of those points, or anybody else, we're certainly open for any discussion, and then I'll read out some of the other questions and statements that have been raised. So there's the question about what would the SEP, how would the SEP have dealt with the outbreak?
I might just speak to that briefly. Look, I think it's a good question, and it's an important question. You know, how should we orient ourselves, and what exactly is the issue? Look, first, it's important to take a perspective as to what the lockdown was seeking to achieve. I mean, it was not the preservation, in that sense, of human life, as much as it was the preservation of economic infrastructure and, you know, stability for markets, so to speak, in order for, you know, things to sort of continue. There was a desire not to, you know, we don't want to, under the guise of, you know, not affecting jobs of the economy, which was, you know, not the main purpose. The main purpose was really to prevent an impact on investment, to prevent an impact on capital flows, to prevent people, you know, prevent an impact on the tourism industry, and so on. It was about defending profit. And when it became obvious that was no longer possible, if there wasn't something done about lockdown, that's when it was enacted. So in the first place, it's important to understand, you know, when we're discussing the flaws of the lockdown, you know, what was the actual aim? You know, because they will always say, you know, look, we're here to defend the people, we're here to protect people, and so on. But, you know, the number of mistakes they made, the number of flaws they made, it's not an accident. I mean, it's because their orientation is fundamentally towards how can we keep business going as usual, and what is the bare minimum that we can do in order to achieve that. So then with the lockdowns, and we have two things that are happening. One, you know, and many of you can draw upon your personal experience. I mean, what was the lockdown like? You know, I don't know if anyone's listening from Melbourne. I think there are some people, but even people in Sydney or Brisbane, other cities. What happened in lockdown? I mean, in a lot of cases, you were prevented from going to certain places at certain times, but then you go to the shopping centres where there'd be loads of people, you know, or, you know, you go to a hospital, you go to, say, a fever clinic, there'd be loads of people right next to you who could potentially be sick. There are all these sort of absurdities and contradictions in the way that was carried out. You know, there was a very poor handling of infrastructure. A lot of people, you know, if you were elderly, you know, if you were working a job in which you couldn't easily go to the supermarket or grocery stores, you couldn't get goods delivered to you online, or you couldn't get, there wasn't any sort of organized, coordinated service to get people the things they need whilst locking down. In a lot of cases, you have to go get them yourself, or go at a specific hour, often risking and endangering yourself. You know, that's the first aspect of it. I mean, the lockdowns themselves are always incomplete and always, you know, half-hearted. A proper lockdown, I mean, requires supporting people to lock down. I mean, to enact proper quarantines, and that people have to have, you know, a very strong say, and people have to be aware of what their needs are. You know, workers would have to organize local committees and organized, you know, organize themselves essentially, and with the resources that are available from society, to address the problem. Whereas here, what's happening is lockdown is just palmed off to the individual. You know, you have to get your own groceries. You have to organize your family. You have to get your affairs in order. You have to deal with your job. It's completely irrational, you know. The second aspect, of course, is that, as I mentioned in my own report, there were significant sections of working class that were never in lockdown, you know. Healthcare workers being the most obvious, but then, you know, you have people in meat factories, people in car factories. There were plenty of things that were given the title of exempt, and it's not just in Victoria, but, you know, elsewhere in Australia, certainly elsewhere throughout the world. And there were still clusters of outbreaks going on as a result. I mean, you know, if one reviews the record, you know, it wasn't just out of the blue at the end of June and July that Victoria had another spike in COVID cases. In fact, they never truly eliminated the so-called first wave. There wasn't a second wave. It was really a resurgence of what was already in the community. There were significant areas of outbreaks, and those simply weren't dealt with. And, you know, it was sort of palmed off, oh, you know, we had 50, 60, 70 cases, but that's okay. It's just one place, we're looking into it. When in reality, the number of cases they couldn't keep track of were actually increasing slowly. And finally, you know, you had a combination of these sort of clusters of outbreaks that came together to form a resurgence. You know, it wasn't just security guards, you know, failing to do their job in a hotel. It was all these other things coming together. You know, so in the first sense, it would have been a proper, rational, scientific lockdown that supported people through it, you know, that diverted society's resources so that they wouldn't have to go to work, that they could educate their children at school. I mean, a lot of the reason that people have been having trouble with these lockdowns and the difficulties is because, you know, they're forced to bear the entire burden of it. What are they going to do with their families? What are they going to do with their jobs? So those are the general points that I would make. But I think I also have to say, I mean, so how's the SEP handled the outbreak? We're a socialist party. You know, we are the Socialist Party, and we advocate that the only way that society's problems can be addressed is on an international basis, where the productive wealth and resources of society are diverted entirely to the defense and expansion of human, you know, of human need and human progress, progress of human society. We're not, you know, there's no sort of element of in our book where we divert billions and trillions of dollars into militarism, you know, into the banks, into tax cuts and all the rest, okay? So in the first place, I mean, there wouldn't have been a situation in a socialist society where a place like Wuhan, where all these meat markets where people were going because they were too poor to get meat from proper safe sources, you know, where a tremendous amount of ignorance exists about what's safe and what's not safe to eat or be exposed to, and where even if it was, they didn't have a choice in a lot of cases. You know, those meat markets wouldn't have existed. And they're not just in China. I mean, to be clear, unsafe sources of food exist in virtually every country to varying degrees, you know, and this outbreak certainly could have occurred in dozens of other countries as well. It certainly could have occurred in the United States. And the fact is, you know, socialist society, by eliminating that very inequality, that very irrationality that allows millions of people to be grouped together in unsafe, unsanitary conditions, especially near animals, that wouldn't have occurred. So in the first place, I don't think it would, you know, had the SEP, so to speak, come to power and had power internationally, an international program for the working class, there would not have been this outbreak. But in the case of the outbreak itself, I mean, it's a rational organization and it has to be done internationally. You know, at the end of the day, the Victorian government itself is not the end all be all. You know, their response has been entirely in line with the interests of profit. But they are just one element, so to speak, of a broader problem, which is the capitalist system. So I just make those points.
Now we have a number of statements and I do want to ensure that everyone's statement is read out. We still have the question on what the SEP would propose in regards to healthcare workers if they wanted to set up a union in their facility. But I'll also read out, Catherine has said, as well as having to try to protect themselves on the job, it must be very frustrating for healthcare workers to have to try to help people seeking healthcare when they are misinformed and don't have any way to really protect themselves because of poor information. I also wonder how readily healthcare workers can get updated information, which is actually a comment or a question that is related to the role of the unions themselves, and which can be addressed when that question is answered. Just again in regards to aged care, Sally Ann has said aged care workers at Howard Solomon Nursing Home in Ferndale, run by the Freemasons, are to have their temperatures taken prior to commencing work. If the RN is not available, the carers must start work, then report for their temperature reading when they can. Tenny from Adelaide also has raised, thanks to the previous speakers for the comprehensive reports. I'd like to comment on the impact of COVID-19 combined with cuts to healthcare on those with mental health issues. As a carer of one with mental health issues, I'm witness to the valiant efforts of healthcare workers to cope with the increase of consumers attempting to access the services. Ambulance ramping, overflowing ED department and lack of beds is creating a major crisis for workers, consumers and their families, with dangerous and often tragic outcomes. Billions of dollars are needed to address the shortages. Only the working class can force a change. The Socialist Equality Party is leading the way here. Maya from Melbourne says, I work in a cancer hospital in Melbourne and I have nothing but praise for the way they have handled the welfare of the patients and employees alike. We have all been temperature checked upon entry for months, offered plenty of PPE and plenty of education as to how to use it. As a result, we have had only one infected patient who infected 2 staff, and the outbreak was contained at that point. Our CEO hosts Zoom meetings every second day, every day at the beginning of the outbreak, to address employee concerns. The level of care and concern has been outstanding, which is quite frankly just a reflection of what can be done if there is a conscious approach to how staff and patients are protected when there is plenty of PPE and what is possible. I think that's a very interesting comment. Warren raises that the question of who is responsible for the cuts in funding is answered expertly by Rick Morton in this week's and last week's Saturday paper. On the role of the unions, they have been largely missing. So has the federal government. The result has been that de facto aged care providers have been making decisions. For example, the decision on people working in multiple facilities is a grey area that neither government nor unions filled, leaving employers to make decisions arbitrarily. Supposed additional hours given to staff affected by these decisions have also been left to management discretion. It is a mess. And Warren is an aged care worker. Maya then says, contrast this with the aged care home, St Basil's, where 2 staff are paid $22 per hour to attend to the needs of 150 residents. Numerous residents were dying of dehydration, that is neglect. My husband is a funeral director and has been burying these poor elderly sacrificial lambs for weeks. It has been appalling. Absolutely. Sally Ann again raises, my work colleagues have purchased their own reusable masks. A few have reported shortage of soap for residents. Just last week, a resident's daughter complained to me how she had purchased bars of soap for her mother and other residents. So, I mean, these are really very important. Now, Kate, who has very patiently been waiting with her hand up since the beginning, would like to answer a question. So I will leave it over to you, Kate, and I apologise for the delay.
That's okay. Well, okay. Yeah. Well, I just really want to speak to the question about how the health system has been eroded and how they were able to do it. Well, it started. Well, I mean, there's never really been adequate funding for health, but I mean, the real, downgrading of it, it started, in the 80s, really, 4 decades ago, and in Australia, it was the Hawke-Keating sort of government, Hawke as Prime Minister and Keating as Treasurer, really, and of course that was in line with, at the same time, in the US, the Reagan, what do you call it? Anyway, the Reagan, the Republican, when he was president, put it that way, I can't think of the actual administration, and also in the UK with, with Thatcher, but also going back to Australia, and Keating announced a recession we had to have, and with that there were, I should recall the numbers, the amount of cuts that were made to the health system then, and then, but how have they been able to do that? Well, the thing is that other, like, then came the Hawke, not the Howard area, when that 1996 the Keating government was defeated in the election. Howard sort of took over. They brought in also cutbacks to health. It's just sort of happened as a gradual thing, and also then Rudd and Gillard and so it has continued again under Morrison. And that, well, there goes the sort of real reason why it's been allowed to happen, is that there's been, that they're all, each government, Labor, Liberal, and state and federal, whoever they are, have all brought about the cuts. So and it's this two party preferred system of the capitalist system, of the parliamentary system, along with the fact that the unions have just played such a really pernicious role, and and really starting back in this country with in the Hawke and Keating, well, under Hawke, the Accord, where the unions and the government and businesses got together. It might not seem in relationship to health, but this and with this Accord, and one of the main sort of parts of it was that strikes were not basically outlawed, but it was the beginning of it, the suppression of the working class and strikes, and that was what was behind it, because in the 70s there had been, and previously, a lot of since the Second World War, a lot of union activity, and with the new stage in the crisis of capitalism, something had to be done to stop, because through those strikes and so forth, from the 50s up to 70s, a lot of some gains were made by workers, such as annual leave, long service leave, all sorts of penalty rates and entitlements, but that had to stop, and so this Accord, it really suppressed strikes, and that was what it was aimed at. And then under Howard was the which was it anyway? But you know, and now sort of with under Gillard, with, you know, the Fair Work Australia, which is actually unfair work. So I hope that goes towards, you know, answering the question. This is, you know, while there's been great, you know, opposition amongst the working class and through health workers, really, you know, in certain, you know, cases, they haven't had a voice, and you know, and well, this is what, you know, the Socialist Equality Party. Well, we said the only way that's going to happen is through, you know, well, actually the overthrow of the capitalist system, and you know, building of a socialist system. But you know, and also just goes into the question about the, you know, what would we say to workers who want to sort of form their own union? Well, one of what the first thing would be say it's not to form a union, because there's, you know, with unions come a bureaucracy. What it is rank and file committees, from my understanding. I probably have a bit limited there, but it's, I do understand it's to, you know, rank and file safety committees within the workplaces themselves, organised by the workers, and you know, with elected representatives amongst the workers. It's completely separate from the union, and it's not to form another type of union. It's to form a very separate thing, which is a rank and file committee. But anyway, I hope that's gone some way to answer some of the questions, and I'll just leave it at that. Thanks.
Thanks, Kate. That's good. We actually have quite a few who indications to speak, and I will have to ask that everybody keeps their comments concise and to the point. Just before I call on Erica, who's the next person to speak, Maya has written saying, totally agree with your comments about what can be done with proper measures in place. We are a very well-funded hospital in a brand new billion-dollar building, and it is very upsetting to me to see the contrast in the way I am treated compared with healthcare workers in other hospitals and aged care. And I can well imagine that that would be the case. I mean, I think as Gary outlined, the concept that we are all in this together is one that was put forward to try and cover over really what the real situation was, because the rich were dealing with the question of the pandemic in a very, very different way to workers. And that, I think, has become increasingly clear, where certainly in Victoria, 80% of infections were caught in the workplace. This was attempted to be hidden, attempted to be, quite frankly, lied about, but had to be finally admitted. It is also the case internationally. There is now really no effort, even of pretense, to try and control the virus. It is herd immunity, in fact, if not in being outlined and admitted to. The concept that there will be money spent to try and stop the spread is now being just rejected. Johnson says there will be no second lockdown. Morrison says there will be no second lockdown. The same situation exists in Spain, in France, and certainly in the centre of world imperialism, the richest country on earth. There is absolutely no pretense that the virus is going to be dealt with in any way unless it affects Wall Street, the stock markets, and the profit levels of major industries. And I think what Maya outlines, what can be done when there is resources, when there is consciousness, when there is staffing, only highlights what isn't done everywhere else. And what the pandemic itself has revealed is that while this system exists, while health is organised on the basis of profit, while education is organised on the question of money, of what is to be extracted in regards to funding, while society is organised on the basis of the profit levels of business, then the resources won't be allocated for what is needed for society as a whole. I mean, you can have, you know, and what Maya outlines is you can have hospitals that function that do not become incubation areas for the virus. But that requires resources. That requires wards to be opened. That requires PPE to be, and not just, you know, N95 masks, but proper full PPE for healthcare workers that are dealing with the risk of infection. It requires, you know, ambulance services to be increased. It requires the increasing of doctors and nurses and the building of hospitals that certainly, and China did do that. Yes, there might be criticism about what they did, but they built hospitals and they closed down Wuhan, and they notified, unlike what Trump put forward, they notified the World Health Organization. They did not hide it, and they did not, you know, send planes from Beijing and Wuhan to the United States to infect it. All that is lies. All that is diversion in order to try and divert attention from what Trump really did in the United States, which was, as has been outlined in the speeches, said one thing to Bob Woodward, who sat on it for 6 months, and that is that this was an incredibly infectious virus. This was a virus that was able to be transmitted through droplets, that you had to lock down everything, and that he wasn't going to do it. And this was put forward in order, as he says, to not create panic, not amongst the population, but amongst Wall Street. The minute the bailout, the CARES Act, was brought into effect, in which trillions of dollars was transferred from the Federal Reserve to the bank accounts of major corporations and billionaires, literally the same week the CARES Act was brought into effect, the demand to reopen the economy, that the cure can't be worse than the disease, went into full swing. And that has been what has been taken place since. So what do we say needs to be undertaken is that the working class itself has to take out of the hands of the capitalist class the dealing of this pandemic. That means a struggle for power. That means that the fight for a socialist perspective. That requires, you know, the development of a leadership within the working class that will fight to lead the resurging struggles of the working class against what is the death sentence that capitalism is imposing upon them. And so I think that many of the issues that have been raised in the discussion today are so important and pertinent, and go to the very political issues that confront the working class on an international scale. But I will ask Erica to speak, and then Will, and then Steve. But we will have to be to the point.
Yes, I'm just making a few comments about Catherine's question. She asked, what information are healthcare workers getting? And they must be very concerned about having to look after people as well as their own health. Well, I'm a teacher, I'm not a healthcare worker, but I'm pretty sure that the situation would be similar to healthcare workers. First of all, they were getting no information about what's happening in their workplace, or generally in New South Wales or Australia, or internationally. The discussion that takes place in my workplace is how great everything is, what a good job everyone's doing. And, you know, only the positives are mentioned. There's no discussion at all about the risk everyone is taking. And secondly, once you get into the workplace, you haven't got time to think about anything because you're so workload is so heavy. You just get on with the job. You haven't got time to even put on a mask or, you know, anything like that. Minimum PPE would be probably there. And this situation has been created by the unions, whether it's the healthcare union or the teachers union. They are leaving people as isolated individuals in the workplace. There's not to be any discussion about the fact that we're in a once in a century pandemic. And I think that goes somewhere to the question about forming a union. I mean, unions today under capitalism, they police the employer's demands. We're not against unions, but the unions today are nothing but enforcers of the gender that's being imposed from above. That's why we're calling for people who want to fight to contact us to develop rank and file committees, safety committees, where, you know, we will work collaboratively and in a very political conscious way regarding the restrictions that are being enforced, to, you know, speak to other people in our workplace, speak to other people in the same situation and proceed, you know, not necessarily risking a job the minute you open your mouth about the conditions in the workplace. We recently a teacher recently got in touch with us. She is a casual. There are a lot of the jobs today are casualised. It is so in the teaching profession. Up to, you know, quarter, half of people in your own workplace have insecure employment. She has been speaking out. She's already been made to feel like she's gone as far as she can go, and this is the situation that confronts every worker today. And the thing about having permanent employment, there's no such thing anymore as permanent employment. I mean, the ability of thanks to the unions, the ability of employers to make your job very difficult, or if not sack you entirely, has really exponentially increased over the last 10, 20 years. There's a couple of points I want to make.
Thanks, Erica. Will?
Hello, I'd like to just say hello to everyone. My name's Will, as Cheryl said. I'm a teacher from the Committee for Public Education, and I just want to say that the issues are really parallel within education and health. You really do see just a great similarity. I just wanted to answer the question that I saw before about should we form a union? Because if you're talking about the traditional unions, it's just that you can get new leaders in and they'll be better. That would be a very big mistake to make. The transformation of the unions right around the world and including in Australia, I mean, I just wanted to read out one line from an economic statement made by Paul Keating, which was endorsed by the ACTU in the 1990s. And it says the government and the union movement are committed to ensuring major capital expansion in Australia receive the greatest cooperation to achieve standards of production which will be competitive with the best in the world. International competitiveness is what it was called, and it goes right across the board. For health and education, it means that budgets have to be met and the unions police it. And I think, you know, on the World Socialist website, we wrote a number of articles about Sally McManus, the head of the ACTU, being best friends forever with the Industrial Relations Minister. And that sort of really underlined the sort of collaboration over decades of the unions. Now, that does not at all mean that we advocate doing nothing. It does mean understanding what's going on, but we advocate definitely this establishment of safety committees to be established in hospitals, old people, you know, where the elderly people are looked after, and schools and everywhere. I've established that I work as part of the CFP at my school, and one of the major things which keeps coming up is that the government is lying quite openly, and I think Julia and Gary mentioned about how government lies trump lying about the spread of the disease. That's going on all the time, and the unions know that's a lie, and they refuse to say anything about it. And so, just the basic thing of providing information about what's going on at the workplace. And, we got lied to the most at the start, being told that children were safe, it wouldn't spread in schools. At a recent union meeting where Sue Phillips, the head of the CFPE, spoke to the head of the the head of the AEU, Meredith Peace, and Peace was going along with everything. And at one point, she was asked about Altaqua, a school where nearly 200 people have got the virus. And because it's a private school, Peace said, it's not one of our schools. It's a private school, in other words. So it doesn't register. We don't have to worry about coronavirus, even though that might be only 2 or 3 kilometres away from a government school. But it showed very definitively that children were transmitting the disease to each other and no doubt to teachers. So the formation of these committees, part of their axis is to actually fight, not on the basis of making Australia more competitive, but on, as I think Gary said, to protect human life. That's the basic premise, and that we're going to actually utilise science, which has been a theme that's been spoken about in one of the hospitals, that where a scientific approach is adopted, people's lives are saved quite clearly. But I think these are important issues, and there is clearly a real parallel with what has to be done in the health system and the education system, the formation of these committees and beginning to provide workers with accurate information as the basis for their struggles.
Thanks, Will. Before Steve speaks, Lisa has written that while there are no or limited lockdowns and the virus circulates in the community, residents in nursing homes and disability homes are locked down without access to family and social supports. There is virtually no training in the disability sector. There is plenty of direction in my disability service about infection control, but due to limited training and supervision and the use of casual staff employed through agencies, it is probably only a matter of time before there is an outbreak. I think that's been proven and reproven many times. I think what Lisa raises is absolutely accurate, and that is a business model. And the 18 different aged care royal commissions and inquiries held over the last 20 years have all identified the fact that the level of training is woefully low, as is the staffing numbers, and the fact that casual staff are forced to work in different facilities in order to get enough hours, in order to get enough pay, and this itself exacerbates the crisis and the risk of infection, which has been proven time and time again. As Maya said, St Basil's is a case in point. Steve, you have to be brief, sorry.
Sure. Look, most of the things I was going to say have been said, but I just wanted to re-emphasize, people, in relation to this issue of the unions, etc., that, people raise this issue because they think that the unions are a defense mechanism for workers. And people just really need to, look around and realize that, this is not the case, that unions are not defending the lives, the living standards of working people. And I mean, just quite literally, one of the key, the health unions are involved with the government in this this collaboration with the employer organisations to restructure you know, working conditions as part of the response of the government to the corona crisis, and the outcome of these discussions is due to be elaborated in the next weeks and months. And so, and I think just, you know, Warren made the point that the unions are largely missing. I think that's the problem, is that they're not missing. They're working. They you know, they accept the constraints of the profit system, and so they have worked alongside of governments of both Labor and Liberal governments to enforce the restructuring, to stop any response by workers to the dismantling of healthcare and aged care and other care, and so that, you know, they're not. It's not, the issue isn't that they're missing. The issue is that they're collaborating with the enforcement of the demands of profit interests. And I mean, a clear example is the way in which the I mean, I was talking to Warren in recently, and you know, they've been in a struggle over a enterprise bargaining agreement, and the union enforces a situation where the employer gives the Electoral Commission the information as to the you know, who's to the staff, which then you know, organise a so-called election. When workers want to find out, well, who's involved in this and who's voting or not voting, the workers are told, well, you're not allowed to know who's doing this, because there's a privacy issue. So only the employer and the Electoral Commission can decide who votes in a union meeting. And this is something that the unions have enforced over aged care workers. And, you know, that's just one of, you know, of a myriad of experiences that people are having. So I think, you know, the issue is the development of taking stock of this, and the development of independent responses by working people. And you know, I think that the point that education workers and healthcare workers and other sections of workers are, you know, they're in a similar situation, and they've got to connect with each other. That's all I'd have to say.
Well, I think on that point, I think the points that Steve has just raised are really very pertinent and correct. And while we could discuss for much longer, I think really we need to wind up. Just in finishing, I wanted to, as I raised at the beginning of the meeting, I just want to draw attendees' attention to Mehring Books. If we could have that slide. Yeah. Now, mehringbooks.com is the website that you could go to, and we have the whole array of really the heritage of the Trotskyist movement, in which we outline and have publications from Marx, Engels, Lenin, Trotsky, David North, many people, and theoreticians and individuals who have written in the course of the last 100 years. I just wanted to draw attention to a few books. We have a deal at the moment on the Socialist Equality Party Statement of Principles and the historical and international foundations of the SEP Australia. It's $12 for both of those books. And these are really the fundamental basic tenets of both the historical and experiences of the working class in Australia, and therefore of the SEP, and the basis of membership of our movement. reading these documents and agreeing with these is the basis on which you can apply to join our party. And it is that we really do want to raise with you all today. I mean, we have had, I think, a very broad discussion on particularly the issues of health. The issue is, though, what we do about it, what is carried out in the face of the greatest crisis that capitalism has entered into, certainly since the Second World War. Outside of the building of a revolutionary party, outside the building of the International Committee, no matter how widespread, no matter how courageous, no matter how self-sacrificing the struggles that the working class will undertake will be, without a revolutionary leadership and a socialist perspective to guide those struggles, they will end up becoming defeated. And those are the lessons of the strategic experiences through which the working class has gone really in the last 100 years. So the decisions that we all make, that you make today, will be decisive for what are going to be the inevitable struggles and have already begun on an international scale. So I would very, very strongly urge you to go to Mehring Books, to order copies of these publications and read them and study them, and also consider joining. The other one that I'd like to draw your attention to is Equality, the Rights of Man and the Birth of Socialism. This is a pamphlet that was written by Comrade North. It was based on the lecture that he delivered in October 1996. This was delivered on the eve of the election of Bill Clinton, and followed the period of the accelerating attacks on the conditions of the working class under the Reagan administration. The lecture itself actually goes into the impact of the Enlightenment on the American and French revolutions. And of course, it's those revolutions, the American Revolution and the Civil War, which has come under such assault from the 1619 Project. So I would certainly urge you to go to Mehring Books and get those publications. I'd also ask you, if we can get the next slide, if you're not already in contact with the Socialist Equality Party, please get in contact with us, either on Facebook at our Socialist Equality Party Facebook page, Twitter at SEP_Australia, or email us at sep@sep.org.au. We would very much want to speak to you, want to continue the discussion with you, discuss your circumstances, your experiences, and also, most importantly, the fight for you to join. Also, if you could and want to donate to the SEP, for which we are always grateful, you can do so at www.sep.org.au/website donate. So with that, again, I thank you for your attendance, for your participation, for your questions, your comments, your contributions, and we will be holding these forums much more regularly, and certainly invite you to further ones, as well as the other meetings that we will be holding online in the near future. So thank you very much for your attendance, and I'll bid you good night.